Thank you, Mr. Chairman. In June, we celebrate Pride. It's a time for folks to gather and lift up and celebrate LGBTQ Americans, the movement for the fight for equality. And we also reflect upon the challenges. And there's an intersection of our conversation here. It's already come up a little bit, that with the mental health crisis that kids are facing, from data last year, 45% of LGBTQ youth reported that they had considered attempting suicide. 45%. Mm-hmm. Youth who live in communities that are not particularly accepting, or families that aren't particularly accepting, report higher rates of attempting suicide. I'm just going to note, and maybe we can introduce it for the record, there was an article last weekend in the New York Times about death investigations and the fact that we don't have complete, after suicides, we don't have complete information because oftentimes they don't ask the question about sexual orientation or gender identity. But in Utah, they are. And it was a fascinating piece that we should have as a part of the record because that's data that we're lacking. But at the same time we're celebrating Pride Month, we are witnessing in America a staggering number of pieces of legislation at the state level that are described as anti-LGBTQ bills. 491 reported so far this year. At the state and local level, school board level, we see a lot of additional activity. I don't have any numbers on that. I don't know who's aggregating those, but it's rampant. And I wonder, again, what the impact of that is on mental health of members of the LGBTQ community. Now, I want to get to a question. We're talking about offering support in schools, but I want to also think of other gateways where people come in and get help. I was proud to co-sponsor the bill that brought us the 988 suicide prevention hotline, and it was made, became operational last summer. And there's the ability with that technology to provide more customized service. I know the first thing people are asked, are you a veteran? And if so, you'll get your mental health services, if you choose, from the VA. But we, along with Susan Collins, we have provided funding for a pilot program in 988 for offering specialized support for people who call, text, or chat on 988 who are identifying as LGBTQ. So how do we use, we have school-based mental health in some cases, but how do we use a gateway like 988 to provide better support for in particular, our LGBTQ population?
Well, Senator, first, thank you for your leadership on 988. As it's a topic that I talk about often when I travel around the country, and I can't tell you how many faces I've seen turn from worry to a look of relief when they know that there's some help actually available immediately when they or their child have a crisis. So thank you for that. It's already making a difference. I do want to say specifically with LGBTQ youth, I agree with you that we need to look for more ways to ensure that they know help is available for them. I think schools are a natural place. I think 988 is a place where early on, if we can signal to young people that this is a place where you can get assistance, where people will understand your unique circumstance and your background, I do think that that is essential. I also think that, and I say this just as a doctor and as a father, I believe that every child deserves to know they matter, regardless of what their background is. The reason my parents came to America many years ago was because they wanted my sister and me to grow up in a country where we knew that just because we had a different color of our skin or our name sounded funny or our background was different, it didn't mean that we mattered any less than any other child. And that's a value we aspire to as a country. We may not always have gotten there, but I think that's a place where we need to do more when it comes to making LGBTQ youth feel that they do matter, that they are valued. And too many of them tell me often that they don't feel that way. They often feel left out or bullied or attacked. And finally, I would just urge leaders, whether they're elected leaders, whether they are leaders in the community, to include LGBTQ youth at the table when they're listening to what communities have to say, and just specifically reach out to them to understand their perspective and their life experience. I've just learned as a doctor over the years who's had the privilege of sitting with patients and who have very different backgrounds and listening and learning to them, that there is nothing that replaces face-to-face contact with people, listening to someone's story, and it shifts how we think about issues. And I think that could not be more important now because too many of our LGBTQ youth are struggling, and you see it in the suicide rates. And to me, that is a five-alarm fire that we're dealing with.
Yes, thank you. Mr. Chairman, I have several questions for the record since I've run out of time, but I thank our witnesses.
Well, thank you very much, Senator Baldwin.